share hi on the button. Just share hi. Hi, 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 hi. I'm not sure this thing is public. Shit. Okay. Send a hi. Okay, okay. If you are joining, then you thank you so much. Thank you for joining. Thank you. Okay, so today I want to share about some symptoms that most times are ignored but could be a pointer to certain challenges. So let me go straight to the point. If you are joining, I'm Nurse Miracle. This channel is a health channel created in the purpose of sharing health tips that can help in health promotion and health and disease prevention. So please, if you like and you are concerned about your health, really want to stay healthier and stronger for your loved ones, join in this conversation. Send a hi if you are joining and let's talk. So what are the common symptoms people ignore that can signal future health problems? First, we have persistent fatigue. Fatigue means tiredness. You sleep for a long time and you wake up, you're still very tired. You still feel like you should sleep more. It's no longer normal. It's no longer normal. So persistent fatigue, usually they pass it off as stress. I'm stressed. But you are stressed and you've rested, but you are still stressed. No, it's not supposed to be. Please, it's not supposed to be. So sometimes it could be a pointer to the fact that either you're having a very poor sleep quality, you're not sleeping well, something around you, you're not sleeping. You know, some people, they are on the bed, but they are really not sleeping. Then that is when you can wake up and still have that fatigue, right? Then we have poor sleep qualities. There we have anemia. Anemia means your blood volume is reduced. You know, ideally a female should have about up to about 35 to 40 thereabout, then a male 40 to 45 above, like that. They usually do check-ins, especially like the last time I did was when I was doing transfusion for someone I really loved. So they will check you so that they will know if you have enough sufficient to for them to take a pint from you and you will still stand, and then they will go and transfuse to the person who needs it for his health and recovery. So anemia, shortage of blood. Most times you're already looking pale. People looking at you that are very sensitive will say, there's how your face is looking. You're looking pale. This one, that could be a tell sign. That's because, come on, if there's not enough blood, just like fuel in your car, if there's not enough fuel in your car will just start slowing down before it stops. But if you have enough blood in your body, it pumps through, carrying nutrients, carrying oxygen, spreading across, and then you're good. So that's it. Then you have thyroid imbalance. Thyroid hormones helps a lot in metabolisms, like breakdown of your nutrients in the body. So if there is an imbalance in the regulation of these hormones, then it can affect. You have insulin resistance. There you have chronic stress is there. This insulin resistance is a very interesting topic, and I'll be sharing a video on it shortly. Just subscribe to this channel, because if you really love to learn more about your health and ways, tips to prevent certain health conditions, subscribe. This is what a lot of people pay consultant fee. You go to the hospital, definitely before anybody talks to you or even listens to you, you have to pay. So I'm giving this out free, this knowledge. I am Nurse Miracle and I am a licensed nurse, and this is my passion. My passion is to help people kick out ignorance, because ignorance is no excuse. Go to the hospital and you know that you didn't know does not mean that you are free. So the better you know, the better for you. So if you are joining, please share a hi on the comment box. Let's know. Let me get to shout out to you. And also today we are actually discussing on health and you. So it's basically talking, we are focusing on certain symptoms that can be a pointer. They are common symptoms, so can be a pointer to some health issues, but they are mostly ignored. So the first one I've discussed is persistent fatigue. That's tiredness, persistent tiredness, that even when you rest, you take some sleep, it does not relieve from it. Then check it more than that. Check it. Don't just relax and wave it aside and say, oh, all will be fine. No, don't just conclude that way. There are more to it. It's good you visit the hospital. Please, this is just basically for health education. This disclaimer, it's not a diagnosis. I'm not saying this is maybe the cause or this. No, 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 no. It's just pointing us and encouraging us never to take for granted some symptoms our body may be telling us and pointing out to us. So the second one is you having frequent headaches. Some of them will say maybe because I went for night vigil, maybe this, maybe that. But if the headache is becoming frequent, that even when you rest too, you still have the headache, if you even have a relief, very temporal, very short lived, then it's a tell sign that there is a lot. So don't take it as normal. Don't take it as normal. It may be that may be linked to dehydration. That is, you've not taken enough water. In one of my videos, I encourage that first thing in the morning, drink water. Drink a good quantity of water, and that is a good way to start your day. So first thing in the morning, drink water. Then next, it could be uncontrolled blood pressure. Yes, I did an outreach very recently in the month of early this December. I did an outreach, and I noticed people who had this constant complaint of frequent headaches. When I checked their blood pressure, because it was a blood pressure campaign, when I checked their blood pressure, it was high. And I checked, and I asked them, what have you done other than that? They said, I beg, it's very common for us to just wave it, but I would encourage you, do not. Because now the headache is there and it's pointing to something. If you ignore it, it can harm, it can cause further harm. Please, I plead with you, do not ignore those signs. It could be eye strain, it could be pointing to your eye. The brain controls several parts of the body. If you are joining, you're welcome. Thank you for joining. I want to hear from you. Have you ever had a symptom that you waved aside? Then, like maybe you had the symptom and you just faked it and you just pushed it aside. Yes, if yes, please type in the comment box. Let's get talking. So because today we are actually discussing on common symptoms that are usually, waved aside, but that can be a pointer to certain diseases. I'm not doing a diagnosis for you, and I would not be doing it here, but my encouragement at the end of this show is to point out some 3 P's that you should use for observation of some signs your body is telling you. And those 3 P's are very key. So stick with me to the end. I'll be sharing it. So some other times, this constant headache can point to poor posture. Some people have some jobs that make them sit for hours or look at a particular screen for a long time. Don't be surprised, you may come down with headaches after those long periods. Yeah, it can be that. Hormonal imbalance can be there too. You can also have some other things. So headaches are messages. Don't feel that, they said they're going to obstruct me now from enjoying my life. No, they're actually your body giving you a sign. Your body telling you that, see, watch this and that. Go and check this, and please never ignore it. Next, we have changes in sleep pattern. Yes. Don't take it as just aging. That you are growing old does not mean your sleep pattern should change. Maybe you can no longer sleep the way you want to. Please, if you are joining, you're welcome. Thank you for joining. Please we are discussing on symptoms, common symptoms that people ignore and can be a pointer to certain health issues, and how to be able to observe symptoms and then tell which is to be a concern and when to go to the hospital. So I'm sharing this to you. these tips, and I'll be going for that. There are 3 P's I'll be sharing, so please stick with us. Then we have sleep patterns. Like sometimes they say it's aging, but it can be a pointer to anxiety. You are scared of something. Maybe you've been having nightmares or something. I don't know. But then hormonal imbalance, metabolic disorders, cardiovascular diseases can be a pointer to why you are having a change in your sleep. you know Cardiovascular diseases has to do with the heart. So if you have problem like with the heart, a developing problem, it can affect your sleep. That's true. If you have a developing metabolic disorders, it has to do with the stomach, the gastrointestinal, the stomach area. So if you have problem with those areas too, it can affect your sleep. You eat and you are having bloated stomach, indigestion. Those are things that can affect your sleep. You're welcome if you are joining. We're actually discussing symptoms that are mostly neglected but can be a pointer. Next is, I've done 1, 2, 3. This is the fourth one. The fourth one is frequent urination, especially at night. You're welcome. Please, you can drop on the chat box. You're welcome to this live session. We are actually sharing health tips on how to watch against certain symptoms your body will be telling you that can be a problem tomorrow. So next, frequent urination, especially at night. Please, for the males watching me out there, if you are over 40, yeah, I'm about to create that video and it will explain in details about prostate enlargement. It's really ravaging a lot. I see a lot when I go to the hospital, and then I know this is a concern. Yeah, certain things you cannot really tell so much as in how to and the rest, but there are some little pointers that can help you prevent it. So you're welcome to this chat. If you've ever had a symptom that you waved aside, type yes in the comment section. Thank you. So when you begin to have frequent urination, especially at night, please don't take it for a joke. It means a lot. So it could mean diabetes or pre-diabetes, that's high blood sugar. And of course, you shouldn't take that for a joke. I've gone to the toilet at night one time when I was in the midst of, I think I was in the camp or something. And then I got there. Due to some droplets of urine on the floor, I could see sugar ants everywhere. Come on, there's sugar in that urine. So please, welcome to this live session. If you're joining, we are actually discussing certain symptoms that your body can tell as a sign, but usually waved aside, and if not caught early. Like I said, prevention is better than cure. So please, if you've ever had a symptom that you waved aside, come on, speak. Type on the comment section yes, and let's get talking about the symptom. What happened? Why did you wave it aside? And what did you do? No, let's just gist. Okay, so like I said, when you begin to have frequent urination, these are common symptoms. But when you begin to have frequent urination, it could be a pointer to prostate problems in men. Like I said, the prostate is beginning to have some, issues, and the rest. Urinary tract issues is there. It could be a pointer to heart conditions too. So please do not take this sign for granted. So I started with when you begin to have, persistent tiredness. You are tired, every fatigue, becoming too tired. Please, that sign is not a sign to really joke about. It could be so many symptoms involved. And next, I said frequent headaches. Oh, you're having headache every now and then, even when you've rested, the headache still persists. Don't associate it to anything. Just go to see your health provider and lay the complaint, and several diagnoses and investigation could later reveal what would be the problem. Oh my. I usually have Favor Udechi. You're welcome. You're welcome to this live session. You're welcome. Thank you. Okay, you said I usually have sharp pain on my left chest. It comes and goes. What do I do, ma? Okay, we would have to talk this. Remember, I said this live session is not for diagnosis. So after now, I will connect with you so that I could guide you on where to go and what to do about that. Of course, like since you said this sharp pain on your left chest and your left chest, it could be a pointer to something, but we'll get to know about what it is, definitely for a guide and to help you better stay better. Then you have other symptoms as unexplained weight gain or loss. In all, I would encourage that please do not keep saying symptoms silent. Do not keep symptoms silent, because that delay in speaking out, if you speak out, you could get help. That delay in speaking out could actually, hamper a lot of things. And by the time, before you know, it's already too critical. So that initial sign your body is giving you is the thing. It's just like your car is giving you some sign. Oh, it's like the water has finished and you're ignoring it. You keep driving distance. Before you know, it can even set the car ablaze because of overheating. So please, the same thing applies to our body. You're welcome to this life. So the next is unexplained weight gain or weight loss. Either both, weight gain or weight loss. Sometimes it's being dismissed to um diet changes. Oh, I started eating this, I stopped eating this, I started fasting, this one down. You should be able to at least trace what would have caused this and the rest. And where you're not being able to do that, you can please give a thumbs up, double tap your screen to like this live. Let's keep sharing it. Let's so that others can join. Thank you. So when you begin to have unexplained weight gain or weight loss, it could be a pointer to the fact that there is something much more than this. Like it could be some disorders in your body. Yes, to be a digestive condition, hormonal imbalance can lead to it. So you should be able to tell, why am I gaining weight so rapidly? Why am I losing weight so rapidly? Both ways. You need to be able to, wait. Thank you very much. Thank you for liking the video. Thank you for joining this live stream. I really appreciate your presence. Next, we have shortness of breath with mild activity. You just walk few distance, like from your room to the toilet, and yeah, you are gasping to breathe. Come on, that is a whole lot. It could point to a lot. So some people say, it's because I'm not physically fit. I'm low fitness. Some people even say this girl, you are very lazy. But it's beyond that. It's beyond that. So you having shortness of breath with just short distance movements and the rest, you've not done anything. It could be a pointer to gut imbalance, food intolerance, acid reflux disease, liver or gallbladder issues, and so many on. It definitely would maybe have something connected to your digestive health. Thank you so much for joining this live. Wherever you are, if you've ever had a symptom that you ignored, a symptom your body gave you a sign that you ignored, now confess, drop in the comment box, say yes, and then let's get talking. Poor wound healing is the next one. Maybe you had a cut and it's about 1 week, 7 days to 1 to 2 weeks now, and it's not improving. The wound is not healing. It's still there, like fresh. It's not normal. Please, it's not normal, and it's necessary that you reach out to a healthcare provider, because it could be a sign of diabetes. It could be a sign of poor circulation of blood around that area. That's why it's hindering the healing. It could be a sign of nutritional deficiency. You're not eating well. Of course, if you don't eat rich food, rich in protein, you would have problems with your wounds healing, because protein, like we know, helps to build, bodybuilding foods are proteins like that, and so on. So, these are certain factors. These are, if you have frequent infections, every now and then, antibiotics is your friend. Give me ampiclos. Please. I even hate people abusing drugs so much. It's not healthy, and it does not help you stay on longer. So please, if you're having frequent infections, it could be so many things. You go, they'll check, your immune system is low. It could be because of you're not eating well. Yeah, so many things. So to me, I'd rather prefer you be on the preventive side. Thank you for joining this live. If you are joining, actually we are discussing on certain symptoms that have been ignored. So now I'll be going straight to the 3 P's. The 3 P's for your symptoms that you should never neglect. What are the 3 P's? Now, these 3 P's will help us weigh a particular symptom, because I'm not saying that for every symptom you have, you should just carry your bag and rush to the hospital. Of course, you know it's not cheap. You get there, you pay consultant fee. Some hospitals take nothing less than 5,000 naira first before they even listen to you. Before they listen to you. So, um, that is it. So then, you need to pay that. Okay, now we are looking at the 3 P's. Now the 3 P's that are the like things you should look at. The rule of thumb. Let me say the rule of thumb you should look at when your symptoms, when your body begins to tell signs. Number one, P. The first P is persistence. Is that pain persistent? I've listed out about 7 to 8 signs earlier. So now, is the pain persistent? Is the tiredness, the fatigue, is it persistent? Like, today is Tuesday. You felt it on Monday, felt it on Tuesday. Okay, like now, favor, are you there? This sharp pain, is it persistent? This sharp pain on your left chest, like you feel it all through the hours of the day? Do you feel it all through the hours of the day? Please type. I'm waiting. I'm waiting for your response. Do you feel it all through the hours of the day? Do you feel it? How frequent do you feel it in the week? How persistent can you rate it? Is it that persistent? Yes, I'm waiting for your response. Okay, so persistence here has to do with lasting longer than expected. Ideally, if you have a mild headache, it should just go away with rest. You drink a lot of water and then eat and rest. You should wake up and be fine if it's just headache with not attached to any other signs and symptoms. But if you wake up and you still keep having the headache and the rest, well, in my country, some persons will just quickly rush up on malaria drugs and swallow, because we believe mosquitoes are just around us. So anytime headache prolonged like that, say malaria. Well, it may not always be. That's why self-medication is not advised. So now the next second P is progressive. I'm here to get your feedback. Favor, this sharp pain on your left chest, is it persistent? Like, how do you rate it? So going further, the second P is progressive. Progressive, like when I mean progressive, is getting worse. Say no, I usually feel it once or in 2 days to 3 days, not every day. It is more like few seconds. I won't be about to do anything unless I lie down for some hours. Okay, now we're getting more facts. Okay, remember I said we have 3 P's concerning checking out signs your body is telling you, and the first one is what? Persistence. How persistent is, you want at least just them to tell me how frequent it is, so that we'll get to know what's really going on. The second one is progressive. Is it worsening? Can you tell us that the way you felt it 2 days ago and today, I don't know if you felt it today, if it worsened, or what's the nature? You know, I used to have some pain some time ago. I could tell that the pain was worsening. Nobody told me. I went to see a gynecologist, and I got proper care, and I'm better off today. So that's what signs in your body should never be ignored. Like, let me tell you something about progression. Let me use taking drugs already. Let's say you've already gone, or like naturally people around would like to do when they feel pains, they will go and hop on, let's say headache now, they will go and hop on paracetamol. It's a very common drug, and so it is also commonly abused. They hop on it, they take the first. Ideally, that drug should be taken 2 tabs for adults, 2 capsules, 2 tablets for 3 times daily. Now you take the first one, and if it's 3 times daily, it should be spaced at least 8 hours. So now, oh, sorry, please, let me set this up again. Okay, so now you taken the first one, and maybe say you take the first one around 6 because you had to wake up quickly. The headache was terrible. You woke up to do something, but the headache could not allow you continue. You took it around 6, and then around 10, the headache is like your head is on fire. Oh, it's becoming something else. So let's say the first time you took it, you just took it once, and that was all. Ah, my life is good. You didn't have to even take again. The second day, you took it, and then later in the evening, you felt headache. Again, you took it the second time, say maybe due to the stress of the day. The third day, you took it, and then midday, like 12 p.m., you had to take it again. And then before you slept, you have to take it. Now you're taking it 3 times, right? You see that it is getting worse, it's progressing. The fourth day, now you have taken it and taking it again. You took it around 6, and then around 10 you are feeling so much headache, and in fact you now say abeg let me take. That's where people start abusing drugs. So as it's becoming progressing and getting worse and the rest, or you now cry out and they give you something much stronger and the rest. The more you take stronger dose of pain relief is also a tell sign that that condition is becoming progressively worse, and you should go to the hospital. Please do not keep silent over it. I encourage you, do not keep silent over it. Okay, the last P. Remember, I said I will be telling us on 3 P's. The first one, persistence. Second one, progressive. And then the last but not the least we have here is problematic. Now, when I mean problematic, I mean it's affecting your daily favor, like you mentioned. You said that it's like the frequency persistence is around 2 to 3 days, once in either 2 to 3 days. So that can be like twice in a week. Okay, then or more, twice or more in a week, but not every day. Then you said it lasts for a few seconds and the rest, but you won't be able to do anything until you lie down for some hours. That is where the problematic case comes in. Hello, if you are joining, you're welcome to this live. We're actually talking on symptoms, common symptoms that are being neglected, that can be a tell sign to a very severe health issues. I'm not here to diagnose any health issues. I'm just here for health education, pointing you on tell signs that once you start noticing, please see your health provider for further check. Do not, because prevention is better. You catch certain diseases early, because if you don't catch them early, they can cause a lot of harm and can be a disastrous. So, but if you have any questions for me, that I can answer within this health education talk, you can drop them, type in the comment box. You can even type a hi, let me have a shout out for you. I'm happy you're joining this live and I really appreciate your presence. So the third one is problematic. Problematic means that it affects your life. You cannot live normally again. Maybe affects the way you eat. You are struggling to eat. You have severe loss of appetite. It's not normal again. You are throwing up consistently. You can't swallow anything. It's not normal. Or you can't sleep as usual. You are struggling to sleep, tossing, or you are oversleeping. It's two ways. Either you are oversleeping or you are tossing too much. It's a problem. Then next is the fact that you can't continue with your day-to-day activities. Certain conditions that once the signs shows, oh, my chest, you just have to sit down and relax for some time before you get up. Please, they are tell signs. So favor, I would advise you see a health provider for further checks. I cannot tell what it is, but since it's having to do with your, like you said, left chest, if a scan is done or something, it could help diagnose what could be the problem. The left sharp pain on your left chest, to know what it is, so that the earlier the better it is arrested. I know certain people will say we don't have enough to care to go to the hospital, but the truth is, if it is worsened, you will spend a lot more. So why not go when the symptoms are just barely starting? Like a lot of people who are survivors of cancer today, it was because the symptoms were caught early. It was caught early. That was why. If Just imagine they ignored it. They ignored it. To have worsened, and their lifespan is shortened. And once the cancer metastasized, it's a story that we only believe in miracle. Well, I'm not miracle, and I believe in miracle, but I would encourage you. Oh, Blue Sky, thank you for joining. You're welcome. I am from Nigeria, and I am a registered nurse from Nigeria, and I have this passion in public. I have an interest in public health. That's my field, and I'm encouraging. I use this platform to share health tips that can promote health and also prevent diseases, because I believe prevention is better than cure. Some of the times you'll be seeing me live on outreaches, because I feel that's my gift to the world, sharing this knowledge to eliminate ignorance as much as possible. Eliminate ignorance as much as possible. So thank you. Oh wow, nice. You're from Northeast India. You're welcome. Thank you. How is your terrain? How is Northeast India? I hope it's peaceful. I hope the weather is also good there. Luska, I'm so happy to have you on this live. I'm really grateful for you joining. Well, I also encourage you and everyone on this live to subscribe to my channel. I share content on health. If you find them helpful and you really want as much as I share them, because some of them are pointers that if you have this idea today, it will help you accomplish. The more I see people go through struggles in the hospital when I go on shift, I get concerned. Some of them I feel, God, if they knew earlier, they would have done certain things and it wouldn't have been this bad. Yeah, so I will be sharing as much as I get info, and I do my researches, and I also see from things around. Thank you so much, Blue Sky, for joining. I really appreciate you. Thank you, thank you, thank you. So I don't know if you have questions, you can drop on the comment box. Comment box if you have questions. Just have some more minutes. I want to spend some more minutes for questions. Okay. If you've learned something today, please follow, like this channel, subscribe to this channel, and I'll continue to share more content and the rest, so you don't ignore important health signs that could be a pointer. Thank you for liking this live. Thank you for joining. But I don't know, I'm giving some few moments to someone who wants to share something or share a question or something. I don't know. Okay, let me recap once again the 3 P's. I know why I'm doing this. Well, I'm doing this because I care about you out there, and I care that you live longer and healthier. So well, if you were to be in the hospital, definitely before you get to us, you have to pay all these bills and the rest before you can get to consult a health provider and the rest, to get them talk to you or listen to you. But right here, in your convenience, I'm sharing these details to you. Please like, share, and so the 3 P's once and again before I wrap up this live session. The 3 P's. The first is persistence. Remember, this live session was basically strictly on discussing on common symptoms that are usually neglected. People just wave them aside and say, "To go," and then they move. So those common symptoms are what I discussed in this live, and I'll be talking on a wrap up of the 3 P's for you to take note of. The first is persistence. If that symptom, if it is a headache, is persistent, or a sharp pain in the chest is persistent, it stays longer than normal, please don't take it for granted. Please go to the hospital. Frequent urination at night, you wake up severally, don't take it for granted. Go and see the doctor for further diagnosis, so that early diagnosis, they can be able to treat this condition, and then you'll be far better off than someone who ignored it and the rest. You have some wounds that are not healing fast, as in sometimes we have some bruises on our skin, we expect them, this bruise is minor, you expect it to go, but it's still there. Please don't take it for granted. Blue Sky, I don't know if you have something to share with us for today. If you're still on the live session, maybe a symptom you found, you experienced some time ago, what you did about it, like, and how it helped you. Okay, so then next, the second P, like I said, is the second P is um, we have persistence, we have the third one is problematic, then the last is the second P. When you talk of persistence, how long it stays, then how often it continues, like how persistent does it affect your day-to-day life, and then lastly, is it really really progressive? Yes, that's the word. Second one is progressive, the third one is problematic. So progressive is that it's getting worse. If it's getting worse, then it should not be taken for granted. Please, 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 should not be taken for granted. So I believe I've shared a lot and I've reiterated severally what to be noted out here. Thank you so much for joining. I really appreciate your presence here. You encouraged me to come up live. I had to take a lot of courage to come out here, and I'm grateful I shared content with you. If you really learned something, you can share in the comment section. Thank you so much. You can double tap your screen to like this live session. Thank you. I don't know if you have a question. If you have, I just give, let me give like 2 minutes for question session. Thank you. Any question over what we've discussed and the rest? Definitely, I'll make this live public so we can still review it again. Thank you so much. Oh, you're welcome, Favor Udechi. Thank you for joining this live. Thank you. I'm feeling there are no questions. I will be leaving out very soon. But of course, if you still have questions, if you drop on the comments, I will follow it up from there. So, Favor, we still have more to discuss concerning what you shared earlier. Yes, yes, sure, sure, sure. You'll see more of me. Yeah. Thank you for encouraging me in this live session. I really appreciate you. God bless you. Bye.